5 years ago, the founders and I got together to create a company with one simple goal in mind. That goal was to help people live as healthy of lives as possible. And we do that by using data science to help providers and healthcare organizations take care of patients proactively to identify the risk of poor outcomes before those outcomes happen.
Over the years, I became very interested in this idea of the utilization of existing data to better characterize patients so that we can better understand observed to expected outcomes.
My background in both the computer science and biomedicine, we have been thinking about how can we utilize the information which is exploded in the hospital electronic medical records.
Today, our solutions are providing risk information on tens of millions of patients. Risk information for risk of disease and utilization. As examples of this, we have the ability to identify where a person or patient is on the risk curve as they trend towards disease state. Secondly, our solutions also predict future utilization. Examples of that are predicting future visits to the ED and also hospital admissions.
We look at thousands and thousands of variables and combinations of variables and build these models around ultimately maybe the 50 things that could explain why a particular patient is at risk for a particular event. So we're not limited to clinical data from electronic medical records or claims data from billing systems. The more information we get, the more accurate it gets, the better the models will perform. But the way we've developed it is in a manner that it can be effective basically today with even limited data sets.
We are a scientific business. That means we put science first. We publish each of our innovations with top journals, top research journals, with rigorous and critical peer reviews.
We're grounded here in Silicon Valley, so of course we have a heavy focus on our ability to do advanced data analytics, computer science, and engineering. But in addition to that, we have additional talent that comes from healthcare performance improvement, healthcare corporations that have done quality and patient management, as well as healthcare providers like myself.
We've made great strides over the past 5 years, and our clients are seeing impressive results. Specifically, we've seen provider organizations be able to reduce their rate of emergency department visits and their readmission rates by 15 to 20%.
We had a really good development partner out of the gate with Health InfoNet, which is the main health information exchange.
We had been talking about the value of the database that Health InfoNet has accumulated over the last almost 8 years now. And that database is rich both in terms of the scope and depth of data, but also the fact that from the very beginning the data was standardized. And so it was really an interesting opportunity to see whether we could take a data set and try to apply it to a concept of being able to predict future clinical events.
2 or 3 years ago, we were approached by our local HIE to see if we were interested in beta testing this product called HBI that was really unique in that it provided both real-time information and it was based upon clinical data.
The use of the tool and changing our model so that way the inpatient team and the outpatient team are communicating. We have seen a 15% decrease in readmission back to the hospital for our patients in this practice.
While our initial focus was in the United States, the issues that we address through our solutions are global in nature. Almost every country in the world is dealing with higher prevalence and incidence of chronic disease, aging populations, and increasing healthcare costs. And our solution is really designed to help address all of those issues.
I've spent the better part of the past decade taking care of patients. It's a tremendously rewarding career and responsibility. And now given this opportunity through HBI Solutions to further impact how healthcare is delivered in the United States as well as elsewhere is a tremendous exciting opportunity that keeps me up many nights thinking about the possibilities.